Are you ready? Yes? Okay, here we go. The finalists pulled numbers out of a hat to determine the order of speakers, and our first speaker is Melanie Morrison. Her faculty mentor is Janine Lupo, and the title of her talk today is Pediatric Brain Cancer and Radiation Therapy, the Good, the Bad, and the Ugly.
Welcome, everybody. So I am a physicist by training and a brain cancer researcher here at UCSF. And much of my research over the years has revolved around the question of how we can minimize the deficits in cure through cancer therapy such that we can maximize patient quality of life once the cancer is gone. Now, this is especially important for children with pediatric brain tumors because they're at a time in their life where the brain is undergoing critical stages of development. In fact, pediatric brain cancer now ranks above leukemia as the most common type of cancer in children, providing more reason for wanting and needing to do research in this area. Now, of the cancer therapies, my current research is focused on radiation therapy and its long-term effects. Radiation therapy is a technique with which high-energy particles are delivered to the brain to effectively kill the cancer cells. And so we would call this the good. But the bad and ugly are what come next, because we know that radiation therapy has negative long-term effects on the brain, leading to cognitive impairment and vascular brain injury. However, it's not quite clear what the relationship is between the two. So if we take the case of a 12-year-old girl who was treated with radiation therapy 5 years ago for her tumor, today she has a decline in multiple IQ points. And when I use advanced imaging techniques to look at her brain, this is what I see. So these tiny black dots here, these are called cerebral microbleeds, and they're a form of vascular injury. I've counted 306 of them in this image. They're also increasing in number and size over time. And so we see a couple of these in healthy aging adults. We also expect to see these in stroke and vascular dementia patients, but we do not expect to see these in children. So our group at UCSF sought out to be one of the first to understand what the relationship is, if any, between the cognitive impairments that these children were experiencing and the cerebral microbleeds. And so what I found so far is that there appears to be a direct relationship between the number of microbleeds in the front part of the brain, called the frontal lobe, and how well patients are performing on tasks involving higher level cognitive function, such as memory and attention. Where those patients who had more microbleeds in the front part of the brain, as a result, performed poorer on the tasks. When I then compared two groups of patients who received different radiation treatment strategies, those patients who received a less harsh radiation treatment strategy, as a result, had fewer microbleeds and performed much better on the tasks. And so this is really exciting stuff because we can see now that the microbleeds can be used as a potential marker in the brain of cognitive impairment. And our hope is that as we continue to study the time course of these microbleeds and their relationship to cognition and radiation, that we'll be able to provide some recommendations to clinicians, such as when to intervene with cognitive rehabilitation strategies, or rather identify those patients who might benefit from a modified radiation treatment plan. And our hope is that as we continue to do this research, that this research will contribute to patients going on to maximizing their cognitive potential and leading independent lives in the absence of cancer. Thank you.